The Numinous Podcast with Carmen Spaniola.
Hi there, and welcome to the Numinous Podcast, where we have interesting conversations with everyday folks about the mystery of life. I'm your host, Carmen Spaniola, joining you from the lands of the Insultion-speaking peoples of the Okanagan Nations. I'm on our small farm just outside of a small town known as Summerland, BC. And I know exactly who is listening to this episode right now. Because even if I don't know you personally, I have an idea of what you've been through, what your poor body has been through, what your nervous system is constantly going through. I do know some of you, quite specifically. I can picture your faces because you are members of the Numinous Network, specifically members of the Sensitive Systems and Long COVID Connection group within the Numinous Network. But if that's not the connection, I know that your algorithm has probably served up this episode because you have some mysterious symptoms that you've been researching at all hours, maybe for years, and you're not finding adequate help in the medical system. So I know you've had to become more knowledgeable than your primary care provider about what you now know to be called maybe dysautonomia or maybe autoimmunity, or it's some kind of post-COVID sequela, or it's something about something about histamines, or perimenopause, or the CHOP protocol, post-exertional malaise and pacing, or it's your endo, or your fibro, or your Hashimoto's, or your MCAS, your MECFS, your myofascial pain syndrome, your costochondritis, your Sjogren's, your non-tachycardic POTS. Sister, I know. She's, gays, theys. I know. If you haven't been researching some kind of mysterious symptomology or elusive diagnosis, then maybe this episode ahead is here in front of you because you've been recognizing the patterns. Maybe you even listened to my episode from like 2022 or 2023 on RCCX syndrome. And you're just like, what is the deal with overlapping phenomena like autism, ADHD, other forms of neurodivergence with LGBTQIA2 plus identity, or with just a variety of other kinds of mental health disorders, and like bad digestion or connective tissue disorder. Like, why do these things go all together? My friend, I know. I may not know you, but I know exactly who's listening right now. You are a nerd about this kind of stuff. And I want to open the door wide, I want to give you a big, hearty welcome. You have found your hyper niche podcast episode that's maybe going to be your new comfort listen. Because between this and the show notes, I bet you will be working this over for months. And I am glad to be here with you. I'm glad you found us. And I'm glad that Dr. Driscoll's team found us. Because, I get a lot of pitches from people wanting to come on this show, like every week. Somehow they find my email inboxes and they show up in my multiple inboxes. And you can really tell, especially in the last 18 months, that most of these pitches are just written by AI. And even the ones that aren't, you can really tell when they haven't actually listened to any episodes of the show. They're just kind of like skimming the show notes. And you can tell that they really don't know what I'm about. Like I, Carmen Spaniola, or this, the Numinous Podcast. Like they will actually pitch white men talking about spirituality to me. And like, as regular listeners will know, like with very, very rare exceptions, I don't want to hear from men talking to me about anything, much less spirituality. However, a man was in my inbox pitching Dr. Diana Driscoll, who happens to be an optometrist and a POTS specialist and an EDS expert. Like, what? That almost sounded so niche that it had to be like some kind of AI chat GPT honey trap set up for me. Like, I was pretty sure I was about to get scammed somehow, because like, what are the chances the exact perfect guest for me would just kind of randomly appear in the slush pile of pitches? Now, again, regular listeners will know that I had an alarming experience, I would say, with almost losing my right eye this past winter. I'm all better now, but, these things are related to Dr. Driscoll's world. And if POTS is a new term for you, welcome to the era of COVID, where more and more people are learning about POTS, postural orthostatic tachycardia syndrome, and also about EDS, Ehlers-Danlos syndrome, which is a condition we've talked about on the show like a number of times, most notably because a couple of our favorite guests, some of our most popular episodes, have mentioned it. So the two Sophies with EDS that are friends of the pod, Sophie Macklin and Sophie Strand, they both live with that connective tissue disorder, EDS, and they've both appeared on the show a number of times. Sophie Macklin was here in 2022 talking about anti-fascist folklore and ungovernable bodies. A lot of crit pride in those, love it. And then Sophie Strand was here in 2023 talking about Mary Magdalene and miracles. And then Sophie Macklin was back in 2023 also talking about a European perspective on times before capitalism. And then most recently, Sophie Strand was here in 2025 talking about disability and the, let's say, non-curative healing journey that she explored in her book, The Body is a Doorway. So again, hey, if this is your hyper niche episode and you want to shake it up sometimes, I will link to all those in the show notes. So that, if you're newer here, you can find your way around easily. I'm also going to link to that episode on RCCX theory of chronic illness that I recorded in 2023, because I'll tell you what, the most fabulous detail was brought to my attention as I was putting together the background and the show notes for this episode with Dr. Driscoll. God, I'm so glad I opened that pitch email, because I normally don't even open them. I mean, yeah. Super great. Anyway, so Dr. Driscoll kindly forwarded me the PDF of her free book called The Driscoll Theory, The Cause of POTS in Ehlers-Danlos and How to Reverse the Process, which I'm going to put in the show notes, don't you know? But I noted as I was going through it, the contributing medical authors, medical researchers credited in the book, and one of them stood out, Dr. Sharon McGlathery. The very one and same, my friends. People who know. If you know, you know. I had invited her to come on the podcast in 2022 to talk about her RCCX theory, but at the time she didn't have the bandwidth. So I just kind of summarized her work in that episode, and within the Numinous Network, I led a couple of sessions of workshops so that we could process it together. It's still available as an on-demand video, the RCCX Theory of Chronic Illness Workshop, and that's in the Numinous Network. You get it with membership, if that angle excites you. Anyway, all this to say, I am totally delighted to introduce to you today Dr. Diana Driscoll, an optometrist, a researcher, also, heads up, a developer of supplements that are specifically designed to support the vagus nerve and symptoms of inflammatory POTS. Now, I just want you to know, I didn't know when we got into the interview that this is part of what she did. Dr. Driscoll has offered supplements for my kid to try, but we haven't tried them yet. My kid is already taking PEA and NAC and specific iron supplements and low-dose naltrexone, all of which have been recommended by their care team, and all of those are being introduced and monitored, so along with other pharmacological supports. So we will see about trying Dr. Driscoll's formulations in a controlled kind of way so we can get a sense of whether they make a difference or not. So I just want you to know, I'm not being paid. I'm not endorsing anything full transparency, I didn't know there was stuff about supplements, and also full transparency. I and my child do take supplements to manage symptoms of autoimmunity and dysautonomia. So now that I've read her book, though, I will say this, I'm actually very interested to try them. Anyway, more about that at the end. I know what you're thinking now, though. Enough of Carmen. I could not agree more. Let's hear from Dr. Driscoll. So, Dr. Driscoll, what identities do you lead with?
Oh boy, this is so tough because I wear so many hats, but I'd have to say, and perhaps it's because I'm working today, clinical director at POTS Care, where we treat POTS patients. Also, I have a research company called Genetic Disease Investigators, president of that, and then a supplement company based on patents I was able to obtain. So work is such a high driver for me because I was sick for, gosh, I was disabled probably over 10 years, sick for about 15, and there were no answers at the time. So I continue that work and helping others today because it was a horrible, horrible journey for us as a family. Yeah, no one should have to go through that alone.
Can you give us a sense of when were you sick and how long have you say been recovered? So what's the
Yeah.
timeline we're talking here?
Yes. Well, understand when I got sick, and it's been 20 years, when I got sick and was ultimately diagnosed with POTS, postural orthostatic tachycardia syndrome, I had no idea what was going on. I had no clue. I just knew I got a virus, and 2 weeks later, things started going wonky, and then I was disabled. So at that time, I was in clinical trials, like at Mayo Clinic, and I kept asking everyone who was trying to treat this by hide the symptoms. I said, but what's going on? Why is this happening? Shouldn't we figure that out first? And once we know that, maybe we could have a direction for treatment. And at the time, the response is basically no. It was the strangest journey. Yeah.
Wow, so this was like 2000s?
Yes. Yeah, it's come a long way since then. Oh, and recovery time, because figuring things out, I ultimately had to walk away from traditional care, which was one of the hardest things I'd ever done. But at the end of these clinical trials I participated in, I was just getting worse and worse. And I asked the head researcher to please throw me a bone. What are you guys thinking this could be? And he said, well, our thought is that POTS patients are perfectly normal. They're just more aware of their own bodies. And I turned to my son and I said, we're on our own. Okay. I know this is medical. I know something tripped us up, likely involved the immune system just because of the viral trigger, but we were on our own. So every answer I got was separated by like 3-4 years. And I get one answer, and then 3 or 4 years later, I'd figure out the next layer, and then through. So recovery was over 10 years. Yeah.
Wow.
But at PodScare, we don't need to take that long. So we know what to look for, how to lay it all out, and lay out a plan for them over the year or so. And then most patients will need some way of maintaining their health. They're not living with POTS. POTS is gone. Okay. They are learning to regulate whatever it is their bodies didn't regulate well so that they don't get sick again.
Mm. So you're saying it sounds like your son
Mhm.
also had it. And also, where in
Yes.
this was your journey to become a doctor? You're an ophthalmologist. Maybe there's more you want to say about how did that overlap with your education and training and career?
Yes, I look back on this now, Carmen, and I think I was set up perfectly for this. If there was any divine intervention, all these pieces had to come in place at just the right time and the right education level, right symptomology, et cetera. And that was me. But I'm a therapeutic optometrist by education and had practiced successfully for a couple decades. I had multiple offices, enjoyed optometry, but that background in eyes really helped me when I got sick and no one else was able to help. One of the first studies I did was I brought in 35 patients with POTS and 35 aged matched normals. And we did every ocular test we could think of. And then I was the blinded doctor. I was given images like of the back of their eyes, for example. And I was told, try to guess who's a patient, who's not. And everything that I would have known as an optometrist and looking at these images, they all looked normal, right? But there were differences. And I started to pick up on that. And I was correct almost 90% of the time. So we took those subtle differences and then went to the next level. So it was multiple years, multiple levels, very frustrating. But beginning in the eyes, although it wasn't a good place to end, it was a great place to start. And then I had medical training, so I could dig through peer-reviewed journal articles. I could look for where could they have gone wrong? What is the current thinking and where may that be going wrong? And I just blew past any thought of this is a psychiatric condition. I knew that wasn't the case. Thought no, it's medical. We're just not thinking properly. So it was quite the journey. But again, I had everything set up. Wasn't just my son, my daughter got sick too. So three of us were sick, and my husband at the time was fine. I thought, okay, it's not something in the house, right? And that's when I set up Genetic Disease Investigators as a corporation. I said, if we're going to do studies, let's go ahead and house it. And what are the chances there's no genetic components to this? If I got sick and then later my kids got sick, I think something's going on that's setting us up for this. What could that be?
Mm. Can I ask you, how old were you at that time? Like,
Yeah.
how old were you when symptoms started, and then when you started to recognize you were on your own?
Yes, I was, gosh, was it 46 or 48? I think 46 when I got sick. And then again, went 3.5 years of
Yeah.
traditional work, just thinking they knew something I didn't.
Yeah.
Thinking that
Yeah. Of
it would
course.
help. Yeah,
Yeah.
I believed in Western medicine. I didn't have any reason not to. But at that,
Yeah.
Carmen, I'd gone to probably 50 doctors
Yeah.
around the nation. You know how it goes, because one system of the body is affected, then the next, and the next, and the next. You're hopping to specialists. And all of the specialists would look at their little area, but nobody was stepping back and looking at what could have happened systemically to wipe out so many systems of the body. And then
Mhm.
what dominoes are continuing to fall. It was like the symptoms would just morph over time. I
Mm.
had a spreadsheet of, gosh, at one point there were 80 symptoms. And before I'd go to a doctor, I'd pull it up and revise it because
Mm.
it was always changing. And I thought it's like
Mm.
chasing a moving target. No wonder
Right.
doctors are frustrated. And no one was
Right.
really equipped to handle it. And they didn't understand anything that was going
Yeah.
on. So
How lucky that your kids had you, because there are a lot of that psychiatric, you got to buck up. You just need to get outside. You just need to do exercise. My child has multiple diagnoses: POTS,
wow,
MECFS, fibromyalgia, myofascial pain syndrome, endometriosis. There's all of these things. And so when
I do know.
our old GP used to be like, you got to get out there and get some exercise, kid. I was like, okay, this is, we're leaving. So let's
Yeah.
back up a little bit here. So,
Mhm.
although many of our listeners have lived experience with dysautonomia, autoimmunity, long COVID, other complex health challenges, today we are going to try to focus on your specialty POTS. But we would assume that other things like EDS and other syndromes might come up because, as you say, it's multisystemic. There's so many symptoms. So for
Yeah.
now, can you begin by giving listeners who aren't familiar with this condition,
Mhm.
postural
Yeah.
orthostatic tachycardia syndrome, just a summary of its symptoms and what, at present, most doctors and specialists advise as first line treatment and prognosis?
Yeah, happy to. The symptoms, as I said, they can morph so much, but with POTS, we have something objective, at least, that we can look at. And that is a patient can lay down, slow down the heart rate, give it 5, 10 minutes at the most, and take a baseline reading and then stand, give it 5, 10 minutes and take a reading. Then you have to hold very still. But when the heart rate goes up well, honestly, over 10 beats per minute, something's up, right? But POTS is not a heart problem. I think that's one way the label is really not helping patients at all. It implies it's a heart problem. The heart is reacting to something, and whatever it is reacting to can cause other problems. So there's other problems. Typical symptoms include headache, neck tightness, blurred vision. Dizziness is number one. Every single patient we surveyed had dizziness. Then the GI tract starts to get involved. Constipation usually occurs with episodic diarrhea, gallbladder dysfunction, pain, then psych symptoms like panic, high anxiety, depression. We can get waves of symptoms, which we call episodes, for lack of any other term, where patients feel hot, their heart starts racing, and they feel real panicky. And it feels like your body is self-destructing, but you can't control your heart rate, your breathing, blood pressure goes wonky. I was shaky, tremulous. I couldn't breathe. Oh, yeah, it was one of the top 5. I felt like I just couldn't breathe. And I knew oxygen was going in because I could breathe and oxygen was going out, but it felt like sometimes my brain was suffocating. And none of these symptoms really meant anything to the doctors, but it did take me to the emergency room a couple times because I thought, I'm dying. Whatever this is, when they figure this out, they'll be surprised I could survive this. It was that bad. And then as the years went, I went from like having dramatic insomnia. It felt like I was flooded with adrenaline to going to extreme fatigue. I'm air quoting fatigue. You can't see that right now. It's really, we need another word, right? Fatigue just doesn't do it. That makes it sound like you're tired. I couldn't move. I remember like raising my hand once and I go, well, that's all I can do. If the house was burning, I'm going to burn with it because I cannot move. This is not fatigue. And then I couldn't stay awake. So I was awake maybe an hour and a half in the morning, an hour and a half in the evening, and it was getting worse. And I asked the neurologist, what's going to happen? Do we just stop waking up? What the heck? You know, um, I had hallucinations. Oh, how do I describe everything? It got to be overwhelming. Yeah, clearly. And I knew that we were going to have to get answers if we had any chance of recovery. My son got to the point, he got sick when he was 8, and he was bedridden for 3 years. He developed severe osteoporosis. He broke his arm just throwing a ball, just putting on his coat. He broke his arm. He was so incredibly fragile. He stopped growing. He looked like a cancer patient. And no one was helping us. No one was jumping up and down saying this is horrible to 2 normally very healthy people. It wasn't a matter of eating right or exercising. I was in great shape when I got sick. I was teaching exercise. My resting heart rate was maybe 50. Nutrition had always been kind of a hobby. So it wasn't like I knew I'd been eating crap, and I need to change that. No. And by saying that to a patient, it puts the blame on them, which is very unfortunate. I knew my 8-year-old son um, was getting enough exercise. He was eating what we ate. It made the thinking of what we were dealing with appear very shallow, myopic, and didn't validate nearly the level of suffering we were going through, which is just horrible. Yeah.
I'm going to note a follow-up question about later when COVID hit and what was
Yes.
going through your mind when
I'm
you saw
happy to
this
talk
happening.
about
And we'll
that.
go there. Okay, great.
Yeah.
But staying with this for a minute,
Mhm.
how do you see this condition differently than the conventional approaches, and why? Like, what do people tell, what do doctors normally tell people who get POTS these days and how they should treat it? And where do you disagree?
It's horrible what is traditionally being done. And I think we're changing it, but it's so slow. It's very frustrating. So, traditionally, doctors will see this as almost like a case of mild dehydration. You know, let's increase your salt, make sure you're staying hydrated. And I thought, okay, I got a virus. I'm not that dehydrated. What the heck? They'll try to slow the heart rate down artificially. And beta blockers are like the worst thing you can give a patient. One, because we need some increase in heart rate because our blood is pooling. And if we don't keep up a fast heart rate, the blood's south, we can't get it north, and that's not good. But also the inflammation that drives the response of this fast heart rate or POTS makes us much more prone to depression. And as I mentioned, anxiety. You add a beta blocker on there, you guaranteed to be depressed. So the traditional treatment for POTS patients is either keeping them sick or making them worse. It's horrifying to see. Yeah.
Mhm.
High salt is very damaging to the cardiovascular system. And they kept us on high levels of salt for 3 years. Every year it's getting worse. And I said, what is this salt doing to us? We know it damages these small blood vessels. What are we doing here?
Mm.
Well,
And exercise. What about, they'll say you should do the CHOP protocol, the Children's Hospital of, is it Pennsylvania? I'm not sure, Pittsburgh
again,
or
I
something.
knew
Yeah. What?
it,
Yeah. Do
it had to be
exercise.
a miss because I was already in tremendous shape. In
Right.
fact, I remember at Mayo, they're doing their initial exam, and he got to my calves, and he said, "Impressive, Diana," jumping up and down all the time. I said, "Would you make a note on my record that shows I'm not deconditioned?" Okay. So if I am so incredibly ill and I'm not deconditioned, how is exercise going to cure me? It didn't make any sense. Having said that, the sicker we get and the more bedridden I became, yeah, you get out of condition, and the decondition worsens a lot of symptoms. But this is not the case of a lack of exercise. We cannot be repeating that to patients. That's horrible, right? Yeah, and it's not. If it was a case of not eating right, I think 80% of America would probably have POTS. And that's not the case. So we've got to think deeper. These patients are really suffering needlessly. Almost half of the patients we see at POTS care have at some point tried to commit suicide. And it's not from depression, it's from the amount of suffering they go through. It felt like, to me, it was torture. I said, this is like chemical torture, waves of chemical torture, and no one can help me with it. You just reach a breaking point, and I totally respect that. Yeah. So it's so much more than that. I just cringe when people say, oh, you just need to exercise, right? Is that what the treatment is, and eat right? Oh, no. So much more than that. Yeah. We got to figure this out in each case.
Mm-hmm. So what is different about your approach then?
We coined the term inflammatory POTS probably a decade ago. And when I put that out there, I remember a lot of the dysautonomia specialists going, there isn't such a thing. I said, you wait, you'll see it, you'll see it. And COVID actually kind of helped explain that. So what my point was is that the heart is reacting to something, much like if you got the flu. And if you get the flu, doctors look for tachycardia, fast heart rate, because some of the inflammatory elements involved in the flu will cause a temporary increased heart rate. And that helps them confirm the diagnosis. When those inflammatory elements are gone, then the tachycardia goes away. But imagine we have a condition where those inflammatory elements aren't going away, they're chronic. Then the heart rate continues to respond. No one had ever approached it that way. Even though they saw the same patterns I saw, even though they saw like a lot of these triggers, it could be inflammatory triggers, no one was backing up and looking for systemic inflammatory problems. And our ability to measure some of these inflammatory chemicals was very limited. And that didn't help either. So I thought, research is so much further along than practice, clinical practice. Let me just stay in the research and treat based on what we know, but it's not in medical school yet. And that was a good start, and then kind of went from there. But we approach it as the heart is reacting. And I think a lot of these comorbid conditions you mentioned, which absolutely we see that, a lot of those conditions are misdiagnosed or totally missed chronic inflammatory problems because we as doctors just don't have the tools that we need to locate those, label them properly, and then treat them.
Would you consider perimenopause, which can also be described as like neuroinflammation and like multi-system, but basically inflammation of your brain, as a comorbid or like a
Yeah.
contributing factor. I'm not sure how you would describe the relationship, but like perimenopause and POTS, is that something that you see a lot?
Yes, and it's not even so much perimenopause and POTS. It's more that estrogen has a fairly dramatic effect on the vasculature, and it has an anti-inflammatory effect to some degree if it's steady. But when there's swings in it, like what would trigger a period, then it's inflammatory, and our inflammatory POTS patients go down hard. So perimenopause is just one example of that, those hormones fluctuating. Oftentimes we just have to stop the menstrual cycles for a while for
Mm.
recovery. I had to stop mine. We stopped my daughter's. And then once she recovered, then she can take it on. But in the middle of all that inflammation, it's a real problem. So I have a Patreon account called POTS Rebels. I released a few posts about the role of estrogen and endothelium and stuff on there. It's rather eye-opening. We as women are more prone to some of these conditions, as you know, like probably 2% of our patients at POTS care are women. I was talking to a friend and he goes, "Oh, well, that just proves women are the weaker species." I said,
Oh,
"No, that proves we have estrogen that's
right.
contributing to inflammation, doggone it. Um, so yeah, it all becomes pretty obvious once you fully understand what's happening, how some of those changes can affect us. Yeah.
Mm. Well, I know there'll be folks interested in your Patreon. We'll make sure we link it in the show notes.
Well, thank you.
In your published research, what surprised you most?
Yes, I've done so much research, have almost published nothing, and that's important for you to know. There's a reason for that. Um, the researchers that I worked with moved incredibly slow, right? And I understand they have to. There's protocol. You spend a couple years just getting money for the grant, and then you set things up, and 5 years later you can publish. And I had so many layers to figure out. So as an individual with a corporation, I could move very fast, and I did, right? So I had no interest in publishing as I went. I just needed to get answers. And like there were sometimes I would call patients, "You want to try something?" Not something you could publish, but it gave
Right.
me answers quickly. And I think there are ways, in fact, I know there are ways to speed up science. And for patients who are suffering today, I think it's important to do that. I fully respect the scientific method. I fully respect peer review. I'm actually a peer reviewer for a journal. Um, but the patients who are suffering now need answers now. And if there's a safe way of figuring things out quickly, we want to do it. But one of the first studies I did, I think that was kind of eye-opening, besides that ocular study I mentioned, was I did a panel of what we knew at the time. And again, that was 20 years ago, of inflammatory cytokines. I was suspecting inflammation was at play. And again, it was almost a gut feeling. I would take ibuprofen a lot of times, and somebody said, "Why are you taking that?" I go, "I don't know. I just feel like I need it." I put a pillow behind my back in the car, and somebody said, "Why is there a pillow there?" I, I don't know that either. I just felt inflamed. Okay.
Mm.
And I'm hoping people won't think I'm crazy. They probably relate to this. And did this panel. It was incredibly expensive. And some of the markers on these patients were like 10,000 times normal. There was one patient went through the roof, and I called the lab and I said, "Is there a chance this is a mistake?" And I said, "Well, nobody else is coming out this high, but we'll redo it for you." Okay, awesome. No, it came out at least as high. And this poor woman had been hospitalized for literally for 3 months. And yet her traditional markers of inflammation, CRP and sed rate, were perfectly fine. So what we learn in school is if a patient has chronic inflammation, CRP is going to be high or sed rate is going to be high or both. And in these patients, neither was the case. We were missing dramatic cases of inflammation using those traditional markers, and we need to go deeper. So that definitely was a pivotal point, I
Mm.
think, in early research.
Mm. I heard a researcher at one of the dysautonomia conferences. I was attending the Dysautonomia International conference like every year for like a couple of years before COVID, just trying to help my patients, as I said, who had like Sjogren's and,
Right.
things that were just like, what is this, and
Yeah.
POTS. And so I heard this researcher say that if someone develops an autoimmune condition that goes undiagnosed or untreated, there's a 70% chance of them developing a second condition within 3 years. And I thought, well, of course you're not treating it. As you say, the symptomology is so unusual, but also B, how would you get a diagnosis when most doctors don't know? So of course, 3 years later, you're still searching, but now you have different or more or additional or dynamic symptoms. So like, it just feels impossible to follow the thread of a condition or get a good treatment plan because multiple threads are getting tangled up. And
Absolutely.
yeah, and then you add to the fact that, just like you said, every specialist is in their own lens, and so their recommendations will contradict each other. So it's
Right.
so difficult to know like who to trust and which course of treatment to pursue, and then for how long
Yeah.
before you try something else. Because it's sort of like, just traditional wisdom would be like common sense. I should probably try something for 3 months or 2 months or 1 month at least to see if it works.
Yeah.
But then what if a different thing happens? So why do these conditions snowball so quickly and
Mhm.
so often?
And a couple of reasons. At first, I want to back up just a little bit because I think it's kind of out there in many cases where they say POTS is an autoimmune condition, right? POTS is not an autoimmune condition. We see more autoimmunity in our POTS patients than the general population, absolutely, but it's not an autoimmune condition. Patients are set up, if you will, for autoimmunity, both genetically and having this chronic low level or high level of inflammation that no one's recognizing, and that messes with the immune system. So if there's a genetic setup to have those inflammatory cells or T cells, whatever, turn on you, a chronic state of inflammation is one of them. What I hope is that some of our work in the inflammatory field and in genetics will set people up to know what they're prone to. And perhaps if it's regulated properly from a very young age, maybe they don't have to go into that autoimmunity. But once that autoimmunity takes off, you are right. Patients have one autoimmune condition, they're much more prone to having others. So
Mhm.
we like to recognize and treat to the very best of our ability as early as possible whatever inflammation we're finding. And I
Mhm.
hope that sets people up for better success throughout their life. But POTS is not an autoimmune condition. And that is something that continues to get repeated in online. I see one of the other things I was able to figure out was there were millions of dollars in research money put into looking for this strange autoimmune condition that must be affecting the receptors of the autonomic nervous system, right? These receptors aren't working and things go wonky. So it looks autoimmune, which I will tell you, it does look autoimmune because it tends to flare and wax and wane, et cetera. And patients look inflamed. But millions of dollars looking for that, and they couldn't really find it. And then when I was digging into this and looking at the nervous system of the parasympathetic nervous system, I thought, well, let's test the receptors. And that was one thing I could just run to the drugstore, test them, they worked fine. And called patients, you want to try this? Yeah, they work fine. The receptors work fine. I used a nicotine patch to test the receptors. They responded rather immediately. So I knew all those millions of dollars of research looking for this weird autoimmune condition that they couldn't find was just a waste of time. Instead, if we have viable receptors, can we use those receptors, get the nervous system working, while then we're addressing the cause of that failure? Yeah.
Mm.
So,
Mm.
yeah.
And so is it different for each patient, or like what are some of the pillars in terms of
Yeah.
making sure that those receptors are working?
Yes. And there are some commonalities among patients. It isn't just these receptors. That was just one aspect, one of those layers I mentioned. And I put in the book, The Driscoll Theory, which is, gosh, it's 15 years old now. I think this will be brand new for most people. I'm happy to share it with anyone interested. We put some of the commonalities in there. And one was what we're just talking about, where the receptors of this autonomic nervous system were working fine. They just weren't getting the signal. And I was able to test it, patented that. I have 5 patents today, which was very validating, I would say, as an independent researcher and patient. Um, and then came up with an oral supplement that would stimulate those receptors, parasympathetics, and that's been hugely successful. Um, and it keeps the vagus nerve working, the nerve that controls every aspect of digestion, heart rate control, breathing. And importantly, it's your anti-inflammatory nerve. That nerve does not work well when those receptors are not receiving the signal properly, which was pretty much rampant. And it wasn't just POTS. We did studies on POTS, chronic fatigue syndrome, fibromyalgia, and interestingly, PTSD. They tend to show a lot of autonomic symptoms. But you can see the pattern of what we would call as eye doctors anticholinergic syndrome or poisoning. It's more mixed presentation than that, but it's classic. It's classic. So that was great for us to be able to figure that out and release that information to help others. Another pillar that's mentioned in that book is there's a propensity to develop high intracranial pressure. And it isn't usually picked up by looking at the optic nerve. Very rarely do we see a patient at POTS care whose optic nerve is swollen. And doctors learn that if a patient has high intracranial pressure, more often than not, the optic nerve is swollen. So we look at the optic nerve, it looks okay, we just blow past it. That's wrong, because the majority of the patients we see, the optic nerve is not swollen. And I have my own theories on that. But when you treat the high intracranial pressure, it's hugely helpful. It's rather immediately helpful, actually.
Can you clarify? This sounds like brain
Mhm.
swelling. What's intracranial pressure?
There's the cerebral spinal fluid that surrounds the brain, goes down the spinal cord, is always being produced and always being drained, right? So if that balance gets out of whack, either production goes up or drainage goes down, or both, or if there's edema or swelling, the pressure inside the skull goes up, right? So when the pressure goes up, there's only so much room in the skull for brain and lymph and blood. The first thing to exit is blood, and patients can't think well. They get really dizzy. A patient who faints, I would have to say, I don't know that I've ever seen an exception to this at POTS care. If they faint, they have high intracranial pressure. It just immediately squeezes that blood flow out. Yeah. So we need perfusion, oxygen perfusion to the brain. That's how it works. So identifying patients have high intracranial pressure is really, really important. And then finally, whatever type of inflammation the patients are dealing with, and it can be multiple times, many, many times, when it affects ultimately the cardiovascular system, cardio, the heart, of course, and then vascular, the inner lining of the blood vessels, the endothelium gets damaged, sets them up for clotting, plaque formation, the veins get weak, dilated, blood tends to pool. I could see evidence of that when I looked in the eyes in that very first study. I did not know at first what I was looking at. I would pick out the patients whose veins weren't smooth, their caliber was irregular. And the arteries were either too small or the veins were too big, but the ratio wasn't right. That was the vascular damage. So another pillar. And then we look for what are some of the causes of some of this. Like high intracranial pressure, for example, is always a secondary problem. We know as eye doctors, high intracranial pressure is always secondary to an inflammatory process. And unfortunately, eye doctors are kind of stuck in it must be a overweight female. What? My 8-year-old son wasn't an overweight female. I was not overweight. It's such a shallow and archaic way of thinking of chronic inflammation. I'm embarrassed whenever I hear a doctor say, well, tell him to lose weight. Oh my God. The majority of patients we have at POTS care are underweight. They're not overweight. Way too much is getting missed with those things. But we can start with the commonalities like that. And again, that's all in the Driscoll theory. Happy to share that.
Thank you. Yeah, we'll link to that. There's also other sort of theories because of course there's people with lived experience are trying to share information. Thank goodness for the
Sure.
internet, right? That we can do that.
Yeah.
But there's anecdotal evidence. There's also some I know there's some doctors with lived experience who have their own theories. RCCX theory comes up in our community a lot around contextual factors as well as the environmental contributors that seem to go hand in hand with these types of syndromes, whether it's dysautonomia, like dysfunction of the autonomic nervous system, or autoimmunity. But it's like first and foremost, yeah, being a woman or being assigned female at
Right.
birth, that's like, okay, that's a risk factor. But
Right.
also, as you've said, like viral exposure. Also, what we see a lot of is like history of sexual assault. There's a lot of folks who are neurodivergent. There are a lot of folks who are queer identified or in the LGBTQIA plus. So just to name a few, right? There's like these
Mhm.
overlapping things. Do you
Yes,
see those commonalities or what? Because
absolutely.
you keep talking about your 8-year-old son, though, and I'm like, wow, outlier, because everyone I know is like, but what are the
Yeah.
commonalities just anecdotally that you see amongst your patients and what does that tell you in your research, or where do you go with your research with that?
What you just mentioned, honestly, you went through a pretty exhaustive list there. We see all that overlap. And I think, unfortunately, so many of the labels that we have for conditions need to change. What one of our goals is to, like POTS, for example, it implies tachycardia. It's a heart problem. It's not. The heart's reacting. The true problem is the inflammatory condition, likely set up genetically. So if we can label it based on the genetic setup, measure it in the blood, we have something objective. Patients dealing with long COVID, chronic fatigue syndrome, fibromyalgia, the list continues. Those are, to me, just junk diagnoses. They don't say anything about what is happening on a molecular level in the body. If we know that and we know why it's happening in each patient, then we have an approach, a therapeutic approach that's proper. But unfortunately, too, for the majority of those patients, mainstream medicine sees us as hypochondriac weaklings. It's the invalidation is horrendous. So those labels need to change. And for me, I think one of my goals is to label them, starting with the genetics and then getting objective markers in the blood and releasing patients from the stigma of having one of those labels. But if you think of patients dealing with a chronic inflammatory condition that affects the blood vessels, affects the brain, leads to, brain inflammation, what have you, high intracranial pressure can affect the pituitary, the hypothalamus, the brainstem. You have hormones gone wild. The effects on the brain are dramatic. Had I not lived through them, I don't know that I would have ever believed it could be as bad as it was. Personality change, hormones gone wild, the hallucinating. It felt like I lived in an alternate universe, which I know some patients can relate to. Very difficult to describe, but I felt like if I moved something in the environment, it wouldn't have an effect on the real world. I wasn't actually in the same place everybody else was. I am so glad that my kids got sick after me.
Hmm.
If they had gotten sick before me or instead of me, would I have looked at their symptoms and the high anxiety, depression, the felt like I was possessed sometimes. I had episodes where of just rage. Oh gosh. Would I have looked at maybe they just need a psychiatrist. But I knew it was medical and we were just going to ignore that. Okay, we'll figure this out. And we did, and they're fine. I'm fine. But yeah,
Well,
would not
as the parent of someone who also has psychiatric diagnoses, schizotypal personality disorder, or is it schizophrenia? We're not sure. It fluctuates. I have also been sort of mapping these things, and it's crazy making as a parent and as just
yeah,
as a citizen of the world that the medical system has these things moving through in parallel instead of integrated, because it's so
yeah,
obvious to me that their period matters. It's so obvious to me that, you know, that there's something
Yeah.
more holistic, I would almost say integrated and holistic happening.
Yeah.
But there's just nowhere to kind of turn to try to integrate the approach.
It's an extraordinarily difficult journey to go through for parents and for patients, right? I was put in the same position you are, trying to figure things out. We're always so happy to see patients at POTS Care who are very young. One, because it's easier to heal, but two, they usually haven't gotten quite married to the psych diagnoses they've been given. And sometimes the identity is put on those diagnoses. We have seen that a couple of times. And we can correct the medical problem, the brain can normalize, and they don't want to be excluded from that group. So that to me is just heart-wrenching. I felt very fortunate that we were able to recognize what was happening to my kids early enough that they could correct personality changes and go on with life and not be crippled by that. But I knew as a patient, I would have easily been probably locked up, you know, crippling depression, waves of anxiety, panic, hallucinations, you know, the alternate universe feeling, the episodes of rage, all of that was so out of character for me. And it came on pretty quickly after this virus and then just kind of got worse over time. So I knew in my heart this wasn't psych, right? I knew it was medical, changing the brain. And if patients are undergoing something, say on a lower level, where they may not be bedridden like I was, how is it affecting the brain and the personality, and how would that exhibit? How much of that is reversible versus nope, it's permanent? My undergraduate major was psychology, and I remember us looking at a patient one day, and he's sitting in the chair and he's slumped over and he's clearly ill. You know, like something is terribly wrong. And they're trying to decide what psych meds to give him. And I said, but he's so sick. Don't we need to figure out what's wrong with him? And maybe the psych symptoms are secondary. And they said, well, we don't do that. We're psychiatrists. We don't do that. I go, well, I think we should do that, you know. So it kind of took that thought pattern I had even as an undergraduate and took it forward of identify the medical problems, correct those. Then if you're dealing with a psych symptom, okay, you know, you're dealing with it, but not to approach every psychological state as a psychiatric condition. If that makes sense.
Right. Yeah, absolutely. Okay. So here on the Numinous podcast and in the Numinous Network, we don't gatekeep. So let me just say back to you what I think you're saying,
Okay.
because I know that all the listeners are going to be like, what did you do? So what I've heard you say is there's something around nutrition or supplementation. There's something around vagal tone. There's something around determining, you know, some kind of genetic testing to determine something there. Like that. So it's kind of like, okay, so there's a bunch of things, but they still seem kind of vague. Like, what are you doing to actually cure POTS?
Yeah. And again, every case is different. I will say you don't have to know your genes, right? That's
Okay.
my interest because I really wanted to get to that point in my own case and that of my kids. And our genetics were not the same, which was eye-opening. I think to change the labels properly, we really want that objectivity. But for patients, we don't have to have the genetics. No, you don't need it. Instead, we can start with those three commonalities, and you almost got it. High intracranial pressure is one. If that's occurring,
Right.
we need to treat it.
Is
And
that something when I go to the ophthalmologist and they're like, we're just going to do your pressures and they go poof, poof in the eye, or is there something else?
no, that's
Okay.
intraocular pressure,
Okay.
which is important. Do not get me wrong. But, intracranial pressure is tougher. The only objective measure would be a lumbar puncture. We don't want to do that, nor do we need to do that to get that objectivity, because lumbar punctures puncture the dura, you know, the lining, and sometimes patients don't recover properly. It can cause Chiari, where the back part of the brain kind of drops into the spine, which is horrible, what we call induced Chiari. So it's painful. It's not high risk. It's risky to some degree, especially in patients with connective tissue disorders. Publications have already been released saying there is a link between connective tissue disorders and poor healing from a lumbar puncture. And when my neurologist was just kind of, coming up empty, so well, we could do that. And I go, let's not. Let's talk about what would be the dangers in just treating it. Like a
Right.
doctor would
Okay.
normally just treat it. So you can treat and look at response to treatment. That's okay. And then the inflammation interfering with the neurology, it was blocking the release of acetylcholine, the neurotransmitter needed by the parasympathetic nervous system. And it wasn't just a vagus nerve problem. That was part of it, but it's a bigger problem than that, if that helps at all. That neurotransmitter is needed by the brain for short-term memory, wakefulness, which is one reason I couldn't stay awake. And we could objectively measure response by looking at the pupil size. So in patients affected by that imbalance to the autonomic nervous system, the pupils are a little bit bigger. That's a sympathetic nervous system override. And eventually they'll get kind of dry. And with Parasym Plus, it would correct within 2 days. It would normalize. Parasym Plus doesn't cause a smaller pupil. It allows the neurology to work properly.
What's
So
this word you're saying? Parasym what?
Parasym Plus,
Oh, this is your supplement?
yes,
Okay.
it supports the parasympathetic nervous system. Plus, it crosses the blood-brain barrier for cognition. When I couldn't stay awake, that whole day, and I was just putting together what the heck this was and kind of working with my organic chemistry and my genetics, making this little mix. What is now Parasym Plus? I needed 4 or 5 doses that first day, but every dose kept me awake for like an hour and a half, maybe 2 hours. And then I start to fade out, and I took more, and fade out, and then ultimately got down to a more normal dose. But I feel like I figured that out almost in the nick of time. Yeah. So we can look at objective markers basically, which is kind of great. So the nervous system change, which we can correct. And then another commonality I think is worth talking about. And we talk about this a fair amount on POTS Rebels, that Patreon account, because it's across the board where the inflammation causes oxidation, and the oxidation damages the blood vessels, ultimately organs, and it changes the brain chemistry, where more symptoms of anxiety occur. And it can appear like anxiety, or it can appear as almost an OCD, attention to detail. We like things a certain way. We have a very high bar. We tend to be at the top % of everything we do unless we're sick, and we expect other people to be the same way, and they're not. So we get harder and harder to live with. But that's the oxidation. And when I had to address that, when it ultimately became crippling, came up with a supplement blend for that. NAC-MAX will start to take down the oxidation. The oxidation, ironically, causes more inflammation. And then the inflammation causes more oxidation. So patients get caught in this cycle, and no one is breaking the cycle. We can support the inflammatory component with Parasym Plus. We can support the oxidation with NAC-MAX and start to break that cycle. And then the body has an amazing ability to heal when we're not bombarding it, with dangerous chemicals. So it was part of the process too. But that is across the board. Patients affected by inflammatory POTS are some of the smartest people you'd ever know. Yeah, great overachievers. I'll tell you.
Yeah.
Yeah. And we get them back to life so that they can do what they're supposed to be doing.
So how open are you to discussing like accessibility? Like how inclined are you to this conversation? Because I just quickly looked it up before we hopped on. Disabilitystatistics.org says that 24% of people aged 21 to 64 with any disability lives below the poverty line in 2023. So then I had to go look up what is the poverty line in 2023 in the US. And the government says it's $15,000 for an individual and it's $30,000 for a family. So to me, a family of four. So that to me, those are like barbaric numbers. Nobody could.
Yes.
And like, so people with these conditions can't work, very often don't have medical coverage. So, how inclined are you to talk about equity here? Because when you're saying, oh, there's some supplements and then we have this clinic and we have it, I'm hearing dollar signs and I'm thinking, how do we help? Or what would you
Yeah.
tell people who are like, Dr. Driscoll, I just absolutely cannot afford the kind of treatment you're recommending. What would you tell them is like the best thing they could do?
And we've been, trying to do this for 20 years. So I know for years before I set up POTS Care, I just helped people as much as I could with things like high intracranial pressure online at no charge. It was incredibly exhausting because you know how sick people are, right? I remember my husband coming home one day and I said, I think I'm sicker from this. And you're so empathetic. So eventually you have to pay the bills, and I get that. But what we're trying to do is spread information as much as possible through, like your podcast, a great example. The thought of inflammatory POTS, for example, that's a new one for so many people. Give away what we can, like the book. Share information among ourselves, and as patients, sometimes we just have to do it. Do you know, I recognize the problems. I was disabled. So I had to stop seeing patients that same day. I couldn't see my next two patients. But I also want people to know, and this dire straits were horrible. Recovery for so many of these conditions is achievable. It may not be easy, it may not be a straight line up, but once you truly understand the underlying problems that are getting missed, then it changes everything. Then your life has a chance to normalize. I will say that. So part of what we want to do today is to share that hope. As a sick person, I could not imagine ever being well again. I remember going to the hospital once. I couldn't get dressed. I just couldn't do it. I showed up in my bathrobe and slippers, and I'm sitting in the hall, and I see the doctor's lounge around the corner, and these doctors and nurses, crisp white coats talking and stuff. And I thought, could I even imagine myself being on the well side again? I couldn't picture it. And now, fortunately, I've been well long enough. It's hard to even remember going back to that deep, dark place where you're sick all the time. Most patients see me and say, I can't imagine you as a sick person. Like, gosh, as a sick person, I couldn't imagine me as a well person. But there's always a way out. So, what we do, because everybody has bills, is we share as much as we can online, social media, talk to people, spread the news. And I hope that a lot of the work I do will spare people from having to go to the 50 doctors like I did. We spent literally hundreds of thousands of dollars trying to get answers, which that should not be happening, right? None of this should be happening. So publishing, talking about that as much as we can to help other people. You bet.
So here, okay, I'm gonna dogleg to my own personal thing. This is
Yeah.
the vanity project part of having a podcast. It's like, okay, great. This person wants to come on this show. I want to have them, but let me ask you about me.
Yes.
Okay, so and of course, as an eye doctor, you have
Yeah.
this like unique lens that you know about both of
Yeah.
these things. So
Yeah.
I had known for some time about eye problems that can go along with like Ehlers-Danlos syndrome, a
Mhm.
connective tissue disorder that, can primarily affect the skin, the joints, the blood vessel walls. I didn't make that connection. I didn't realize there was a strong connection to POTS. And here I'm now currently recovering from an acute case. And this will be like new for people who don't follow me on Instagram, but are just longtime podcast listeners. Here's what's been up. So I had this acute case of multinodal necrotizing scleritis that developed last year. And for people who don't know what that is, basically it's like my eye was like attacking itself. And so it
Yeah.
gets these like bumps, nodes all around the eyeball that
Yeah.
become scars and then start to die. And it can affect your, blindness is the
Yes.
sort of natural outcome of that.
And pain.
Oh my God, it hurt to
Yeah.
cry. And Dr. Driscoll, I cry for a living. So that, like
Oh.
basically I was like, that's my job. And I couldn't sort of tell people like, wow, it feels like lava is coming through my eye as you're telling me this sweet story right now. It was going on for months, but I didn't have a doctor. Anyway, the long story short of it is, I guess the case I thought, oh yeah, this came on quickly. And my ophthalmologist was like, there is no way, you had to have been in pain for months. And I was like, well, what is pain? Like I just kind of lived with it, because what would I do? I didn't have a doctor. I couldn't get a referral. It was too far away to the clinic. Anyway, so my eye, it was treatment resistant at first. It took a lot of months of like really high dose prednisone and different things and methotrexate now. But it finally turned the corner this past January. So my ophthalmologist and my rheumatologist, they're very relieved that I didn't lose vision in my eye. I was kind of like, oh wow, that was okay. They seemed very like, I was seeing them every week for several months. So I knew it must be serious, but I didn't realize. Anyway, so I'm on immunosuppressant drugs for probably 2 more years before they said that they'll even consider tapering me off. And so I was they're like, your eye has been so inflamed. And they kept saying like the inflammation, the rheumatologist could not figure out, yes, I have a million different kinds of symptoms that are sort of adjacent, but he was like, I can't diagnose you with anything. So we're just going to keep you on this medication. So essentially I'm like, okay, so what I'm hearing is stop the inflammation. And I'm like, does that just mean every single thing I can do, like low inflammation diet? Like what? I'm already on menopausal hormone therapy. I'm already like, what does that, if inflammation is the root, what are the things that you would say for people who are like, I know I have a million symptoms. I don't know if it's POTS. I don't know what it is, but I know I have these like weird, for instance, like the thing that happened with me, I have this weird eye thing. Of course, and my kid has a million different things. So is anti-inflammation kind of the best thing we could do if we have fairly low access to specialized medical care, or because we just don't have the money for it?
This is so incredibly tough. And I think and first, for people listening, I will say that necrotizing scleritis is not something we typically see like with POTS or whatever, but you're an excellent example of it's an inflammatory condition, or generally is inflammatory. There's a few types that are purely infectious, but this sounds inflammatory. Where the scleritis itself, the inflammation of the white part of the eye, if you will, it can be so severe that the white part just kind of melts, and hence the blindness occurs, and extraordinarily painful. But if you step back and look at it, is this genetically set up? Is this a systemic? Is this just one manifestation of a systemic inflammatory problem? And if so, are there any other symptoms, anything else that's kind of going wonky that could address treatment? I think ultimately for you, we'd love to see, some sort of genetic component figured out. But I doubt that something that responds to methotrexate, an anti-inflammatory diet, is going to be significant enough to affect it. But methotrexate, I'm so glad someone's helping you with that. And that could be just a miracle drug for you. You don't ever want to mess, with losing your vision. But I would be curious if a way to help you is to step back and look at it more systemically. Is anything else going on? In scleritis, the itis, of course, is inflammation, and the blood vessels are dramatically affected. So the circulation to that part of the eye goes way down, and it's just like starving, for oxygen and blood supply. It doesn't get it, and the tissue breaks down. So is this a vascular problem? And in inflammatory POTS patients, we always have to look at the vasculature to see other things that could be affecting the vasculature. There's a page on our website called Inflammatory POTS. It's decent, I think, for patients to look at and go, Okay, what inflammatory conditions like are we seeing at POTS care? What has been ruled out in my case? What could be left, right? But I think in your case, that's fortunately a fairly unusual presentation, but it is vascular. So your eye is recovering, which is wonderful. That's the best news ever. Um, but I would look to see, is there anything systemic going on? Are you prone to clotting, for example? Do you have a genetic disorder that would set that up? Is there any autoimmunity, like an antiphospholipid syndrome, what have you? Are you prone to a vasculitis in any other part of the body? So yeah. So I think without poking into your personal symptoms, we don't really know at this point, but that's how we would see it as one presentation of a systemic setup. Yeah.
So thank you for that.
Sure.
And I want to give the listeners who are like, but what do I do? So it's
Yeah.
like, so Dr. Driscoll, what would you tell people who are like, okay, I'm opening up my fridge or I'm looking at my schedule or I'm like
Yeah.
in our zone of influence and little things we could do today.
Right.
Would you say like, is it rest? Is it whatever you can do to work on your sleep? Is it not eating, certain foods? Like what are some things they could do today that could help people kind of soothe themselves a little bit to be like,
Yes.
okay, I can figure this out and I'm just going to start with this little act of care.
Yes. And do know there's always a way out. I think that's so important for patients to hang on to. And when I was going through this, I had to remind myself regularly because it was such an uphill climb. There's always something. There's always something else that be considered, right? You're not done with every possibility at this point. Um, but number one, for inflammatory POTS, you don't have to know what type of inflammation exactly this is to know it's affecting the cardiovascular system. Inflammatory cells that release chemicals that affect the cardiovascular system usually involve histamine, the vast majority of those. So histamine is so hard on the blood vessels and heart. If you start antihistamines like Zyrtec, I double dose it. In a couple of weeks, you could be more functional. It's not a cure, but that's one chemical you don't need to be messing with. And I would stay on that until POTS itself is gone, frankly. The histamine receptors on the heart and in the gut are not affected by Zyrtec. They're affected by Pepsid AC, a histamine 2 blocker. You just can't stay on that long term. But maybe for a month, or if there's loose stool, I would jump on it and take that down for a while. And again, usually patients will feel better. The inflammation will affect neurology. So that's where Paracin Plus will correct that immediately. Correct it immediately. And NAC Max will help with the oxidation and you will absolutely feel better. And then I think looking at the material, and again, I'm happy to share the book on that covers high intracranial pressure could be really important. Our patients with high intracranial pressure, they can correct everything, but if their pressure is still high, they feel horrible. You've got to bring that pressure down, and that could just be life-changing. I remember when we figured out that component, I told my neurologist, I can survive. I can handle the rest of this. Okay, my quality of life is somewhat affected, but this was such a big help. I'll be okay. And then 2 or 3 years later, it wasn't enough. Other things were happening, and it just kept getting worse. But for a while, it was a huge relief. So that combination, antihistamines, Paracin Plus, NAC Max, and a look at the potential for high intracranial pressure can change lives. That can be enough. Sometimes that's enough, right? At POTS Care, we really like to have the patient leave with a firm diagnosis of why this happened with objective evidence of it so that they can set themselves up for success throughout their lives. They don't have to worry that the next virus that comes along, or trauma or whatever, starts them over. You never want to have to go through that again. So to learn how to regulate what their body's not regulating properly so that they don't get sick like that again becomes super important.
Mhm. How do we bring down high intracranial pressure? Is that a complicated process?
Well, there's medicine for it.
Okay.
Acetazolamide or Diamox, what's used like to prevent altitude sickness. It's a different condition, but we'll take the pressure down and do it pretty
Okay.
quickly. Yeah.
Okay. Okay. What were
Mhm.
you thinking when it was the early months of the pandemic when COVID first hit and there was
Oh,
so
yeah.
much like medical uh journalism coming up about it. We think it's this, we
Mhm.
think it's that, we don't know. What were you thinking, say a
I
year
already
into
knew.
it? Yeah,
I
okay.
already
Okay.
knew. In fact, we had already figured out that SARS viruses have an ability to trigger chronic inflammation in those predisposed. And that was likely what got me and, frankly, my son too. So when COVID came along, I told the staff at POTS Care, brace ourselves. This is a SARS virus. This could be significant enough to trigger an inflammatory reaction in patients, and they'll be prone to inflammatory POTS. And we went remotely immediately, and that's exactly what happened. So they're estimating 10 to 14% of post-COVID patients are developing POTS. We would say inflammatory POTS. We were ready for it. And it's
Mhm.
the same process. Once the virus itself is basically gone, right? You're no longer treating this as a viral problem. You're dealing with the sequela of that virus. You're dealing with the inflammatory sequela. And that makes patients more prone to developing high intracranial pressure. It interferes with the neurology. And it was fascinating to watch where they thought, oh, patients tend to survive better if they smoke. And of course, smoking is bad. So they had trouble aligning that. And I knew, having patented the use of nicotine for the receptors of the vagus nerve, the anti-inflammatory nerve, is what they were noticing. So, and then they went to, oh, this is a vagus nerve problem. No, it's not exactly a vagus nerve problem. It's a parasympathetic problem because the inflammation is interfering with that neurotransmitter. I'll just watch. I just watch this
Mhm.
lay out very slowly. So they're getting there. But again, this was patented 15 years ago.
Mm.
So they'll figure that out. And then the effect on the cardiovascular system, and seeing in the eyes the damage to the endothelium. Yeah, that's exactly what's seen. Like the propensity for clotting because the endothelium is damaged. The inner lining of the blood vessels is no longer smooth. The inflammatory cells can stick. There's more potential for plaque development, weakening blood vessels, everything from aneurysms to blood pooling when patients stand up. And patients who are prone to clotting have a double whammy. So we always check for clotting in patients and then see what kind of inflammation is this? How can we protect the blood vessels while they heal and keep them from having further sequela to that? That's what post-COVID patients are dealing with. Probably 40% of the patients we see at POTS Care are post-COVID. Yeah.
Mhm.
And it's the
Mhm.
same presentation. Yeah.
Yeah.
At first, the COVID patients were getting some validation because it was COVID, and the doctors were a little bit afraid of COVID. They didn't know what sort of chronic problems could occur. They were looking at, is the virus still active in the body? Is that because it feels like it?
Mhm.
Um, but once the doctors rule out the possibility that it's still a viral problem, then the patients lost all credibility, just like chronic
Mhm.
fatigue or POTS patients. Then they start looking at them like maybe it's anxiety,
Mhm.
just gone through
Mhm.
so much from your journey, you can't recover mentally from it. And it's really unfortunate they're not recognizing that inflammatory component. But we were
Mhm.
ready. Yep, absolutely
Mhm.
ready. Mhm.
Mhm. Where are you taking your research next?
It's always geared toward the genetics, right? That was when I first set it up, that was our ultimate goal. So figuring out how to move past POTS is great, but I really don't want to exit stage left without changing some of these labels.
Mm.
And to me, the genetics makes the most sense because it's so objective. And patients could know from a very early onset, like birth, what they could be prone to. And we need to change Ehlers-Danlos syndrome. That's another thing that is very sloppy. We're using a label which implies a genetic problem without knowing the genetics. And we're using that label based on the presentation of signs of connective tissue problem. But it completely takes away the treatable components to that. And that needs to change. I think people are suffering without treatment for a condition that they assume is just a genetic setup, where actually a chronic inflammatory condition can weaken connective tissue. We need to look at that component because that's treatable, and stop using the same label for everybody and telling them what I was told was genetic. There's nothing you can do. That's entirely wrong. I am still hypermobile. Someone would still say I'm EDS. I'm not sick. I don't have POTS. That was not the cause of illness, if that makes sense. So those are our next goals. Yes.
Very
Mhm.
worthwhile goals.
Yeah.
So, how do you cope with the grief, the rage, the frustration in
Yes.
your job, but also on a personal level with
Yes.
everything you've been through?
I'm so glad you asked that. That's such an incredible journey for most people. Like on the POTS Rebels, we spend a fair amount of time to offer support because they feel like they're not being validated. And there's a fair amount of anger, resentment, trauma just from the journey itself, right?
Mhm.
The way I was able to get on top of it was I looked back and I thought everything I figured out was brand new. Of course, the doctors didn't know it. Like, that's how I got 5 patents. It was all brand new. No one ever looked at it this way. So I can't fault them for not knowing this. They're not researchers. They're not devoting, 24/7 for 15 years like I did to getting answers. Most of them did the best they could with the limited knowledge they had, and that helped. And then ultimately, there was a fair amount, as you've probably seen online, fair amount of hate, directed at people who are doing things differently. And I knew I just had to do things differently. And any hate that came my way, I thought, I have nothing to prove to anybody. My own recovery is enough validation for me. The recovery of my children is enough validation. And ultimately, helping patients at POTS Care, I don't need to prove myself to anybody. And it gave me a certain amount of peace. If I was still fighting for recovery, it might be different, maybe not. But I felt like, no, I've achieved what I need to achieve. Now I'm just going to help others. Um, I don't have that same level of resentment or anger or incredible frustration. Um, I couldn't understand why no one was really digging for the underlying problems driving this. And even, like I mentioned, the connective tissue problem, they said, well, you have Ehlers-Danlos syndrome, causes a gradual of laxity of your blood vessels over time, so your blood will pool and you'll develop POTS. I go, okay, I know that sounds right to you, but there was nothing gradual about my illness. And I was in my late 40s. My son was 8 years old. It also didn't happen gradually. The more study I made on connective tissue and collagen, I recognized that the connective tissue and collagen inside blood vessels is different from that of the ligaments and tendons. And unless I had Marfan syndrome or Lloyd-Steed syndrome or something, which I did not, that should not be affected. So I thought, no one's thinking this through. They're slapping a label on, telling me to live with it, and no one has really thought through the science and looked for the treatable aspects, and they're not thinking that deeply. So it was incredibly frustrating. But helping patients is the most rewarding thing ever. The empathy that I feel for patients will never go away because our journey was so long and so tortuous, right? Um, so yeah, it's extraordinarily rewarding doing that. And when we look at there's a reason for everything, which I would have never believed going through that journey. I can kind of see that now. I would never want to have to relive that again. Um, but now I think enough time has passed from that torture that I can go, okay, maybe. But yeah, but helping other people, focusing on others helps you move past that trauma to some degree, right? Yeah.
Well, thank goodness for lived experience researchers and practitioners like yourself, Dr. Driscoll. And thank you for sharing all the information. I'll get all of the links from you and put them in the show notes, but also just for the inspiration and the hope.
Yes.
I think about my kid and I think, yeah, I will do anything
Yes.
to help, and so
Yes.
I've been saying here, you should be taking your antihistamines because of course, like this is knowledge that we have in our community in the Numinous Network. And somebody's like, oh yeah, I did that. And I'm doing antihistamines twice a day. And so I was like, well, maybe my kid should try this. And now I'm going to be like, okay,
Yeah.
I'm going to be over there every day being like, okay, it's time for your morning antihistamine. Okay, it's time for your
That's
evening
right.
antihistamine. So thank you so much for sharing. And thank you for being on the show. It was great to chat with you.
And thank you for sharing. I'm just one voice, and you can amplify that voice to so many. The work you do is incredibly important. I would have given my right arm to have had a podcast such as yours to share information when I was a patient. I felt like I was just floundering on my own. It was just that just makes it incredibly tougher when you're all by yourself trying to figure it out. So thank you for amplifying that voice. Appreciate your work so much. And for anybody listening, I think emphasizing that hope, there's always answers. Unless you have every medical condition that you know exactly what's happening, you're not done yet. So never give up. It's very tempting to throw in the towel. Been there many times. Don't give up. Yeah, it's worth it.
Okay, friends, I know you're excited about it now. The book, The Driscoll Theory, is available in the show notes. It is free. There's not even an email sign-up paywall and nothing like that in front of it. It's just right there in the show notes. It's a 127-page PDF. So that's like a 250-page paperback, friends. It's like an excellent bonus just for listening. We thank Dr. Driscoll so very much for that. I also want to note it does have some specific recommendations and dosages for various approaches. Like it has a ton of research and information, along with the contributions from other medical researchers with lived experience with these types of conditions. So what an interesting conversation with Dr. Driscoll. I'm also going to link to all of her support services and websites. There's like 4 or 5 of them. And as well, of course, if you would like to be part of the Numinous Network, we have pretty much weekly, like 4 times a month, we have a gathering for people with sensitive systems, meaning you have a sensitive nervous system for whatever reason. Doesn't matter if you have a diagnosis or not. You've got mystery symptoms, etc. And people with long COVID. Again, you don't have to have a medical diagnosis for that. It's people who want to opt in to be with people who get it. And it's always guided by people with lived experience. We have 4 different guides, and we work in a very trauma-informed, somatically grounded, attachment-oriented way, and always through the lens of how we are being impacted by systems of oppression and how just trying to survive capitalism can give you an autoimmune disorder. Just trying to survive patriarchy can give you or exacerbate an autoimmune disorder. So, yeah, we get it, and we would love to hang out with you. And so just as we are winding up here, kind of an oh, hey, by the way kind of thing, I've got a thing going on. I've got a new book coming out this fall, November 2026. It's called How to Connect, Build Deep Connection and a Strong Bond Through Contact Nutrition, no matter your attachment style, trauma history, or neurotype. It's a book for people who don't want to go to therapy and the people who love them. And it's not about nutrition like supplements. Contact nutrition is made up of kind eyes, vocal prosody, safe touch, shared rhythm, and ingestion behaviors like eating and drinking. And it's the heart of what we're doing in the Numinous Network. Now it's available in book form, or at least now available for pre-order in book form, soon to be on shelves and in bookstores in November 2026. Now, There are very exclusive care packages for the first 25 pre-orders, 25 Canadian and then another 25 US, different care packages depending on the border situation. And for all the other early birds who order before May 31st, you'll have a spot at a very relaxing, soul-nourishing contact nutrition half-day retreat, which is going to happen online in November. Plus, when you pre-order early, you're also going to receive any other bonuses that are rolled out during the pre-order period between now and November. And I can tell you, there are at least 2 more coming with a combined value of like over $55 US dollars, right? So the sooner you buy, the more bonuses you get, my friends. So pre-order my book on contact nutrition now at carmenspanyola.com. CarmenSpagnola. Until next time, my friends.